Inner Voice, a heartfelt chat with Dr. Foojan.
What if your emotional life didn't have to feel like a constant reaction or a constant recovery? Welcome to the International Awareness Integration Institute Virtual Clinic, a global online clinic offering psychotherapy, coaching, integrative well-being services, and mind-body practices, all in one place. At International Awareness Integration Institute, we don't just talk about change, we train it. Our work is guided by awareness integration theory, an evidence-based psychological and educational model designed to reduce anxiety and depression patterns, strengthen emotional regulation, and help you build a life that feels meaningful, steady, and fulfilling. Whether you're navigating stress, relationship strain, burnout, life transitions, trauma symptoms, or simply the feeling that you've outgrown your old life, you'll find a clear path forward here, supported by licensed professionals and expert practitioners. If you're ready to feel better, think clearer, and live fully, join the International Awareness Integration Institute Virtual Clinic today. Visit awarenessintegration.com and book your first session or join our membership.
After a considerable discussion, we came up with calling it neuroplastic so that everybody would know that there are nerve pathways involved that have been changed in the brain by stress or trauma or emotions or some other challenge in life. And that there's a real physical underpinning to this condition. This is not imaginary. It's not injury. It's not organ disease. But it is a physical change in the brain that is leading to either signals going into the body, producing problems like with the patient that I mentioned earlier, whose bowels practically shut down, or a different processing of signals coming from inside the body, what we call interoceptive signals that are being processed in a different way.
Introducing a powerful new update from the Foojan app. Now with flexible subscription plans to fit your journey monthly, quarterly, or yearly. Our new AI-driven onboarding customizes your path to feeling better, faster, and enjoy a refreshed experience with stunning 3D interactive videos. Update now. Empower your inner voice with Foojan. Download today. If you've been doing your best, but still feel stuck in anxiety, relationship stress, or the weight of old patterns, this is where things begin to shift. At the Awareness Integration Institute Virtual Clinic, we offer something different. We provide two pathways forward. In psychotherapy, our licensed clinicians help heal unresolved trauma, reduce anxiety and depression, and navigate life transitions. In coaching, our certified coaches help you build confidence, leadership, and relationship mastery, turning insight into decisive action. Both are guided by Dr. Foojan Zeine's evidence-based awareness integration theory, a structured roadmap from awareness to integration to action. During our summit, save 25% on all services from March 22nd through 29th. Visit awarenessintegration.com to book your first session or request to be matched with the right provider. Welcome to The Inner Voice, a heartfelt chat podcast. I'm your host, Dr. Foojan Zeine. I'm a psychotherapist and author and the founder of the International Awareness Integration Institute. Today, I will be talking with Dr. David Clark. He's the president of the Association for the Treatment of Neuroplastic Syndrome, ATNS, which is a nonprofit organization dedicated to ending chronic pain epidemic. Dr. Clark holds an MD from the University of Connecticut School of Medicine and is board certified internal medicine and gastroenterology. He is a host of the podcast, The Story Behind the Symptoms. His organization's mission is to advance the awareness, diagnosis, and treatment of stress-related brain-generated medical conditions. So we will be talking about his latest book. It's They Can't Find Anything. Oh my God, so many of you guys probably have had the experience where you have some condition, some upset, some pain somewhere. Something just wasn't working and the blood test just didn't show anything. The scans didn't show anything. And they're like, well, I don't know. All I can tell you is I don't know.
And I've had so many clients who come to me and say, I've spent 6 months going from one doctor to another, from one scan to scan, and ultimately spend so much money. And they finally tell me, I don't know, it must be in your head. And so it is wonderful to have Dr. Clark explain in this book, they can't find anything wrong. 7 keys to understanding, treating, and healing stress illnesses. And in this conversation, really went through looking at, how does that happen? How does your brain dictate to your body or works with your body in holding your, kind of maybe protecting you, or a way that is holding your body that then creates some illnesses or pain, and what are the paths to look at it and diagnose it, and then looking at what to do with it. It was a great conversation. I've had him before, and it's wonderful. I always learn from him. And it really reiterated the concept that of the awareness integration also theory, and the clinic, the online clinic that we started, which does bring not only psychotherapy, coaching, but it also brings mind and body, yoga, breath work, and meditation, and also functional medicine and nutrition all together, because it all works together. And it is so important to take all of these components together and be able to release the stress and release and see if there are traumas where you could actually release. So it was beautiful to talk to him and really see how much the medical industry and the psychotherapy needs to come together to be able to create this body-mind cohesive alignment together. Now, be sure to subscribe to my podcast, this podcast, and my YouTube channel, and connect with me through my website, FoojanZeine.com. Go to awarenessintegration.com, awarenessintegration.com, or IAII.life, and connect with a therapist, coaches, mind and body programs, and functional medicine. Everybody's there for you. You get also the Foojan app and Mira, the chatbot, who can support you in between sessions, or if 2:00 in the morning, you have some questions to ask and nobody's around. Guess what? Mira, the AI chatbot, which is trained in awareness integration, is there for you. So you can actually gain some skills and share and gain some skills from the AI chatbot, which is trained and really captured by our methodology that can support you anytime you like. Connect with me, my social media. And again, I love to hear from you, your comments, questions, maybe topics that you like me to bring the guests and we could share with. Now, without further ado, here's Dr. David Clark.
Listen up if you want to promote your personal growth and self-awareness. I found the Foojan app last month and I have been absolutely loving it. I personally have never learned guided meditation, but thanks to this app, I now have learned incredible tools for my own stress relief and emotional self-awareness. Not to mention, there are self-evaluation tools and professional coaching available to utilize however your journey to self-discovery takes you. Join Foojan today and redefine your life one step at a time.
Yeah, sometimes the mind understands, but the body still holds the stress. That's why the International Awareness Integration Institute Virtual Clinic offers mind-body services that help you regulate your nervous system, restore calm, and return to yourself physically, emotionally, and mentally. Our reflective practices include guided mindfulness, breath work, yoga, and grounding exercises, and specifically curated to support emotional regulation and physiological calm. Our somatic integration practices are a refined body-led approach where healing begins with presence, working with breath, sensation, posture, and gentle movement, so resilience becomes felt, not forced. And for those who want deeper whole person support, we offer functional well-being guidance, addressing the interplay between hormonal balance, digestion, sleep architecture, and lifestyle factors with a root cause holistic framework. This is not self-care as a luxury. This is self-regulation as a life skill and a pathway to fulfillment. Choose the support your body and life have been asking for. Visit awarenessintegration.com to join a weekly meditation, explore somatic healing, breathwork, yoga-inspired movement, or functional medicine services, and start feeling the difference.
It is a joy to have you, Dr. David Clark. Welcome to the show.
Thank you. Great to be with you.
Thank you. You are a doctor, which is close to my heart. Let me tell you why. There have been so many times that I have gone to physicians and they've done all my blood work. They've done everything that they could. And they look at me and they're like, I don't know. Might be, it has to be psychosomatic. And there have been times where I've debated and I said, no, I'm a therapist. I know it's not somatic, all of that. And then, I turned around and I started looking at the different angles of the stress in my life and things that I was going through and how much all of the way that we hold stress in our body. I've been molested and abused as a child. And a lot of my trauma had held in my stomach and my colon and my muscles. And for a long time, I had no idea what even these things meant. And I had to go through a lot of somatic work beyond, as a psychotherapist and the trauma work to be able to release many of it. So when I learned about you and I, read your book and I'm like, oh my God, thank you. Can we look at these matters? And so thank you for joining us for us to be able to talk about this. But I really want to know how from looking at things only from a medical concepts and looking at blood tests and, MRIs and scans, that you also came to an understanding and this became an interest to you.
Yeah, it's a fun story. It's a little bit embarrassing to tell it as a physician because I went through so many years, 7 years of pretty traditional Western medical education without ever hearing anything at all about this. But I have to back up for a second and just say that your response to the idea that this could be psychosomatic or what we call today neuroplastic was definitely helped by the fact that you're a psychotherapist. Many people, when they first hear this, they are very resentful. I mean, the idea that their mind could be doing this to their body, it just doesn't seem possible. It doesn't seem like they have enough stress in their life, either past or present, to be doing something like this. They know the symptoms are in their body, whether it's a bowel problem or back pain or fibromyalgia or chronic fatigue. And the idea that their own mind could be doing this, it seems just impossible. And they also feel resentful that they're being made to feel like, oh, you are mentally weak somehow. You can't handle your own stress. You're not as good as other people at managing the ups and downs of life. And doctors often assume that these symptoms are not real, that they're just in your head, they're imaginary. And all of that combines for people to just get annoyed, resentful, skeptical, all these different reactions that people have that prevent them from getting the care that they deserve. And that was very much the case with a patient that I saw in the 8th year of my formal training, who had severe gastrointestinal problem for 2 years. Diagnostic evaluation completely normal. She actually came to us at UCLA, where I was in training from another university. We did some specialized testing. That was normal as well. I was doing her exit interview, telling her, I'm sorry, but you're going to have to live with this. But we kept talking, and eventually she shared with me that she, like yourself, had suffered abuse as a girl, and it was pretty severe. And I had never heard this from a patient before. I had no training in how to respond to this. I didn't even ask her about it. She just spontaneously began telling me about it. And the idea that this could be related to her condition, I had no training at all that that was possible. I mean, she was 37 years old. The abuse had stopped 25 years in the past. But it gave me something helpful to do, which was to send her to a psychiatrist named Harriet Kaplan, who was also certified in medicine, who was familiar with these issues. And I thought, okay, maybe Harriet can help this patient live with her condition a little better. And I forgot all about her until 3 months later. I ran into Harriet Kaplan in an elevator, which became the elevator ride that changed my career, because between the ground floor and the fifth floor, she told me she had cured this patient with 3 months of weekly counseling sessions. And that just blew my mind, that you could alleviate a serious physical condition. This woman was moving her bowels once a month for 2 years, and that you could alleviate something like that just by talking to somebody. Never heard that before. Assumed it would be rare, but I thought, okay, if I'm going to be a complete gastroenterologist, which was my specialty, I should learn a little bit how to do this. So I had Harriet teach me her framework. And when I got into practice, there was nobody like Harriet in Portland, Oregon. So I began to try to do some of this work myself. And I was shocked to be encountering 5 or 6 patients every week. It was 1/3 of my practice that had no injury, no disease, and yet they had severe, real symptoms generated by the brain in this neuroplastic process. And they could get better if you started talking to them about stress and trauma and emotions and other challenges in life. And I absolutely loved it. The idea that, without technology, without medication, without surgery, I could make people better just by knowing what to ask and what to do with the answers. It was wonderful.
What led to naming it neuroplastic treatment versus the psychosomatic? There's a shift of the name. And so I wonder, what was the shift for the terminology?
Yeah, well, nobody likes a term, no patient certainly likes a term that has the phrase or word psycho in it. We used to call it psychophysiologic because we thought that would help the medical community understand what these conditions were, but the patients didn't like that, and it was hard to say. So then the International Association for the Study of Pain came out with the term nociplastic. And the plastic part is very hopeful because it means a capacity for change. And, noci has got, a Latin or Greek root relative to pain, but nobody knows what noci means. So after a considerable discussion, we came up with calling it neuroplastic so that everybody would know that there are nerve pathways involved that have been changed in the brain by stress or trauma or emotions or some other challenge in life. And that there's a real physical underpinning to this condition. This is not imaginary. It's not injury. It's not organ disease, but it is a physical change in the brain that is leading to either signals going into the body, producing problems like with the patient that I mentioned earlier, whose bowels practically shut down, or a different processing of signals coming from inside the body, what we call interoceptive signals that are being processed in a different way. And a good example of this is if you whack your thumb with a hammer. You have actually are not generated a pain signal in your thumb. What you have generated is a damage signal, which goes up to your brain, and your brain has to then decide, is this a pain signal that we want to generate or not? And of course, with if you whack your thumb with a hammer, it's going to want to generate a pain signal because it'll indicate to you that there's some danger of additional damage here, and you want to be careful about what happens to your thumb until it heals. And that's why the brain creates the signal of pain. But in other circumstances, it may get a damage signal and decide not to give you a pain signal. For example, if you are spraining your ankle while you're running from a predator, your brain is going to decide, you know what? You don't need a pain signal right now. You need to get to safety. Once you've gotten to safety, then we can give you your pain signal. So it's actively determining this. And that role of the brain is one that, because it's plastic, it can be changed. And by identifying the stress issues, traumas, emotions, and so forth, we can help people change the brain back to a healthy configuration.
One of the things that I had experienced with my own body, and then when I work with trauma with clients, is also just checking this with you, because I don't see it. I experienced it from another angle, and I wanted to check to see with your expertise and your research how that sounds. That a lot of times that when people are going through the stress and through the trauma, that they also hold their body in a particular way in order to protect themselves. And somehow that way of holding your body becomes a habitual protection concept, right? So, for example, if somebody is I've worked with people who were physically abused, and depending on how they were, they would hold their body in a way to protect. So the way they held their body is almost their muscles held on to that protective measure, even if the abuse wasn't happening. Or, for example, with sexual abuse, holding in their like lower abdomen part, and all of those muscles would hold the stress in a particular way. So many times, as we were working through the trauma, the imagery, and that they would actually feel the pain and how they were holding their body. So sometimes we had to actually do the movement to release these type of stress from the muscles, from almost like their cellular level of how much they held. And so even when you were talking about, like not having a bowel movement, I had many clients who were sexually abused and had the same symptomology, because they were, at the time that they were being abused, they were holding every part of their body in stress, and then holding, even when the person was no longer there, the trauma response from their body was still, to be hypervigilant and hold those muscles and organs in place. Is that part of the trauma that the body holds, the memory that the body holds? And so when we not only talk about it, bring it forward, but also like breathe into it, release it, move it, that the body begins learning that I can let go and I'm safe now, and I can use other protective measures versus, holding my muscles tight for a long time, or my spine in a particular way, so that I've imagined that's the only way that I can protect myself. What are your thoughts about that?
Yeah, I agree. Absolutely. People do hold their bodies in certain ways as a way of protecting themselves. And then you've also got the sympathetic nervous system, the fight or flight or freeze nervous system is activated when people are subjected to trauma. And that tightens certain muscles. It slows the GI tract down. It slows digestion down. One of my patients had a completely paralyzed stomach. Not the belly, but the actual organ of digestion inside was completely paralyzed. We tested it to see how rapidly it was emptying. There are standard tests for doing that. His was not emptying at all, and it was because the sympathetic nervous system in his case was switched on to a very high degree by, in his case, an ongoing fear that was so severe he couldn't even put it into words. I mean, he wasn't even fully consciously aware of how much fear he was experiencing. And yet it was having this tremendous effect on activating his sympathetic nervous system and getting the stomach to shut down. But that also, contributes to anxiety levels that people can experience. And if those go on for too long, can contribute to depression. Post-traumatic stress symptoms obviously can be a big part of this. But most people that I was seeing were not fully aware, not fully recognizing the magnitude of what was going on. Many of them, and this may be different from a psychotherapist, but the people who wound up in my office, when I asked them, what did you go through as a kid? Did you Did you experience anything that you would never want for a child of your own, for example? And many people initially would say, well, it wasn't that bad. Other people have been through worse. I don't think it's affecting me today. But when I asked them to say, okay, look, we're going to really focus in on this, I want you to imagine your own child growing up exactly as you did in the same environment for, let's just say, a week. And you have to be a butterfly on the wall of your childhood home and watch this happening to your child or another child that you care about. What's that going to be like for you? Are you going to see anything that's going to make you sad or angry? And many people, you'll see their facial expressions change when they start thinking about this, and they will begin to recognize the magnitude of how much they endured, and they'll start to connect with some of the emotions that they had at that time that they've since repressed.
Yes. It reminds me of, I worked with a client who, she came to me because of a trauma of two accidents that happened, car accidents that happened right back to back. But she would get this choking sensation that like she couldn't talk and she couldn't even breathe. And she did all of the different types of tests and nothing showed up. And we started looking at, the accident didn't do anything necessarily for her to have a direct correlation so that she would have anything to do with choking. And then the conversation went back to how with her family system, and they were an immigrant in another country, that with her family system originally and being an immigrant, she had learned to hold her voice and not say the things that she needed to say, whether to her father, to her mother, or to the new society that they were in. So whenever she got scared, what happened naturally was for her to stop. Her voice would stop, and it's almost like she should not talk. So the choking was like, you cannot talk. So we did a lot of the trauma work with our conversations, and at one point, it seemed like her nervous, the system had become so automatic that just doing what I do usually with trauma we weren't able to just release all of that. And she had to actually go to Japan to do a particular movement to calm down the vagus nerve, and because it was so rapidly holding her, it was such an automatic process. To bring that from the automatic and subconscious into the conscious was holding different layers, which she just would not go to. And finally, this treatment, which just did a lot of work with actually the muscles of her neck, was able to release. And then all the crying started and all the memories started and it just started letting go and releasing and releasing. And finally, she was absolutely cured of that. It was fascinating.
Yeah, it's a great story. When you spend your entire childhood strengthening those nerve pathways that are shutting down your ability to speak, they get very strong. And it can take a lot of work to finally reverse those and enable the nerve pathways that give you a voice to finally take effect. There's another aspect of this that may not have been prominent in that patient, but certainly is in many others, which is, I know, part of your work, which has to do with self-esteem. So many of my patients who were mistreated as kids, one of the messages of that, one of the assumptions that is pounded into the child is that you are a second-rate human being. You are not as good as other children. You are a failure. You are worthless. And abuse can do that. Or if the parents are fighting with each other, the child is trying to solve that problem. They're trying to be a peacemaker. They're failing to solve the problem, and so they feel terrible about themselves. They try to be the best little kids they can be. They try to be perfect. They're very self-critical. And very importantly, they often never get the chance to really be a child and to play, because they are so focused on the needs of other people in that household. So that when they grow up, they've got all of these personality characteristics, the low self-esteem, the perfectionism, the constant focus on pleasing other people, and never taking regular time for their own joy because they feel like, I don't deserve this. Plus, they never got a chance to practice it as kids. They never got to play sufficiently as children, so that as adults, when you ask them, what do you do for fun? What do you do when you want to take a break? And they're not so sure. They don't really have that much very often. They're too busy taking care of everybody else in their lives to put themselves on the list of people they take care of. And sooner or later, if you do that long enough, your body is going to protest one way or another.
Yes. Everyone get this book. They can't find anything wrong. 7 Keys to Understanding, Treating, and Healing Stress Illness by Dr. David Clark. And it's a lot of amazing stories of it's written in different case studies and stories. So I'm sure that everyone who reads it will find themselves somewhere in this spectrum of those. So when you talk about 7 keys to understand, can you share a little bit about how do we come to understand if something is related to the stress versus other matters, for example, that they're physical. So whether it's pain or there's some part of our body is not functioning, how do we go from, is this really a body function, a medical issue, or is it more a stress related, and I'm holding a certain belief systems, I'm holding certain memories that is creating the factor, that I'm in pain?
Yeah, well, it always starts with looking for injury or disease. I mean, this is certainly how I was trained, that as most people assume, if you've got pain or illness, it must be due to injury or disease. But it turns out there's this whole other category of brain-generated neuroplastic symptoms that affect actually 40% of people who go to the doctor, and somewhere between 1 in every 3 or 4 adults will have a neuroplastic symptom. And the process starts with making sure you don't have an injury or disease, doing whatever appropriate diagnostic tests there are. And then we get suspicious about it being neuroplastic, not only because the tests are normal, but often because there's more than one symptom at a time that people are suffering, or the symptoms are highly variable, or they are moving from place to place in the body, or they're not triggered by the same thing every time. And that also points away from an organ disease or a structural damage toward a neuroplastic condition, because the brain, of course, through the nervous system is connected everywhere. So if you've got symptoms in lots of places, or they're constantly fluctuating up and down, or they fluctuate in response to stress, that gives us solid information that it's probably a neuroplastic condition. Then I'm doing a stress evaluation. What stresses are you having in your life right now? And can we find a link in the timing? When the stress in your life right now is up, are your symptoms also going up? A patient of mine, very simple, but none of his other doctors found this out. He only got his symptoms when he was driving to work. When he was driving home from work, he was fine. Very simple. Another patient, I don't see children very often, but they begged me to see this 9-year-old boy because he'd seen every other doctor in town for his unexplained stomach pain, and nobody could figure it out. So I said, okay, because any pediatrician will tell you that small children are not small adults. They are completely different. And if you try to use your adult medical training on a kid, you're probably going to make a mistake sooner or later. But I said, okay, he's already seen everybody else and there's nothing going on that they can find. Well, it turned out to be very simple, because the only time he got his stomach pain was when he was scheduled to pitch for his Little League baseball team. On days when he was scheduled to be in the outfield, he was fine. So diagnosis made. That was a fun case. So the next thing I look for is anxiety and depression. And those can be missed because many people with those conditions, when they present to a doctor, they are presenting with a physical symptom, something wrong in the body. And if you ask them, do you feel anxious? Many of them will say no, because they've been anxious for so long that it just feels normal to them. Same with depression. They might admit that, yes, I'm feeling stressed out or exasperated or frustrated or desperate to have you fix whatever symptom it is that I'm coming in to see you for. But they will say, no, I'm not depressed, even though they have many of the other symptoms that go with depression, like sleeping problems, low energy, losing interest in activities they used to love to do, thoughts of harming themselves, not sleeping well. Those are all, hallmarks, red flags for depression. So I'm looking for all of those. I'm looking for trauma. Have you been through a terrifying or horrifying event, either in the past or more recently? Colleague of mine in Arizona told me a story of a patient who'd been terrible symptoms, rushing from doctor to doctor for 6 months. Nobody could figure out what was wrong until he asked her about trauma. And sure enough, right before her symptoms began, she had been a hostage during the robbery of a store. And for 40 minutes, there was a handgun pointed at her neck, and her symptoms began right after that. And then I've saved the biggest category for last, which is adverse childhood experiences, or ACEs, which can be anything that you would never want to happen to a child of your own. So yes, it can be sexual or physical abuse, or it can be violence in the home, or substance abuse by a parent, but it can be much more subtle things. One of my patients, the only time he got praise from his parents was when he did something better than his brothers and sisters could do it. And he had 3 very accomplished siblings. It was rare that he could do something better than they did. So he grew up feeling like a failure. And it had the same consequences I was talking about earlier. He tried to be perfect. He was very hard on himself when he wasn't perfect. He didn't take much time for his own joy. He was constantly trying to take care of everybody else in his life, including the person he was in a relationship with, who had lots of problems that he was constantly trying to solve for her. And so he was in a very unbalanced relationship. And I see those all the time in my patients. So I'm looking for all of these things. And the good news is that all of them can be addressed. All of them, as you very well know, as a therapist, can be successfully treated in people.
Yes. And the other side of it also matters, which is people who have been injured, or they do have an illness that is a physical illness. And I think that the neuroplasticity also supports them in, the frame of mind, their mindset, and how they see themselves, how they see their own capability of moving toward the treatment and through the treatment. Also supports them in healing faster and having a better prognosis versus a person who goes into their depression around it, or the anxiety about the illness itself, right? So we've had a lot of different research that shows people who have had cancer and they're going through the treatment, the way that they are, their attitude about it, how they hold themselves, how it shifts how they handle matters, as obviously the discomfort of treatment that they're going through, and how they hold a meaning after the treatment is done. Can you share a little bit about also how this is so important? This is important not only in creation of some symptoms, but how much it is important also in recovery and treatment, and from the other side toward health.
Yeah, well, if there was any justice, if you had a neuroplastic symptom, you would never get a biomedical disease like an organ disease or structural damage. But of course, you can have both at the same time. I have patients with inflammatory bowel disease who have irritable bowel at the same time, or somebody with rheumatoid arthritis who's got neuroplastic pain superimposed on top of that. And it can be difficult to tell when you first meet a patient the relative contributions of the neuroplastic part of the pain or illness and the organ disease or structural part of the pain. But I'll go through the same process. I'll identify the sources of stress, try to address those as much as we can, and then we'll see, does the physical condition improve in response to that? Does the pain go down in response to that? And very often it'll go down more than you might guess.
What are your thoughts about autoimmune diseases?
Yeah, great question. It turns out that the more adverse childhood experiences you went through, the greater your risk for having an autoimmune disease as an adult. And it's a pretty strong effect. And we don't know exactly what the connection is, but the theory is that the adversity as a child is somehow activating the inflammatory system in the body. We know that the brain and the immune system are connected. That was first discovered in the early 1980s by a researcher in New York State named Dr. Robert Ader. And it's likely that what's impacting the brain in your ACEs is having some effect to activate the inflammatory system part of the immune system, and that may then play out over time to increase your risk for an autoimmune condition. What we don't know is if we use the treatment measures that work for neuroplastic symptoms, will they also affect how your autoimmune condition plays out over time? Will they reduce the long-term damage from that autoimmune condition? Will they help the autoimmune condition become less severe over a period of time? We don't know that. It could be that once you get to be an adult and the autoimmune condition is underway, that by then it's too late. And it would be a very difficult research study to do to see if neuroplastic type of treatment, neuroplastic recovery therapy, would be able to change the course of an autoimmune condition. We've also got, along parallel lines, increased risk from ACEs for things like cancer, diabetes, and heart disease. So at the very least, it gives us a bigger reason to try to intervene when people are still children.
Very much, yes. I want to show the book again for They can't find anything wrong. 7 Keys to Understanding, Treating, and Healing Stress Illnesses by Dr. David Clark. Dr. Clark, anything we haven't shared that you really want people to know?
Well, certainly that there's tremendous hope. There is a series of randomized controlled trials that have been done at leading centers across North America, published in very rigorous scientific journals that are showing tremendous outcomes from the therapeutic approach that we're calling neuroplastic recovery therapies. The Boulder back pain study, for example, Boulder, Colorado, people with an average of 10 years of chronic back pain, in 4 weeks of treatment, their pain was 75% better. And they didn't give them any more treatment than that, just the 4 weeks. And they've followed them up now for a total of 5 years, and their pain levels are still down. The UCLA study, older male veterans, very tough group. You're not going to get anywhere throwing a bunch of psychobabble at those people. They were trying to get them to a 30% pain relief goal, and they got 63% of them. Again, with a very short space of treatment, 63% reached the goal. They compared it with the older type of cognitive behavioral therapy, which is widespread in the United States, as you know. Only 17%, about 1/4 as many, reached the goal. So it's this new form of treatment where we identify the sources of stress and we help people to overcome those. That is showing the greatest effect.
Do you think that because it is also happening within the medical field, that it's being taken a little bit more seriously versus what you said, like, I don't want the psychobabble. So although it's almost like you're bringing it together and integrating it, so it could be that they're more apt to listen and move forward versus when we separate it, that this is the psychology and this is the medical industry, then the psychology angles of it just takes a lesser, not quality, but lesser advantage.
Or lesser acceptance. The research clearly shows that if you send somebody to a mental health professional for a physical problem like pain or illness, 80% of the time the appointment doesn't happen. Where you get the best outcomes, as you just pointed out, is when the physician and the mental health professional collaborate with each other, so that it all becomes part of the same process. Just as the mind and the body are intimately connected, the treatments need to be intimately connected, so that when the physician determines there's not disease or injury, they can bring in their behavioral health consultant or their stress expert or their psychologist and say, we're going to assess you now for brain to body neuroplastic conditions, which are just as physical as any other form of illness. And that's when the best outcomes happen.
Yes. Where can people find you?
Right now, our website is called symptomatic.me. And we're in the process of updating it, so it may have a new name some months down the road. But we've got all the resources there, evidence-based. We've got videos and courses and an annual conference. Had 350 people came in 2025. And so many resources there that people can begin to work with, including a self-assessment quiz that takes less than 2 minutes. And people can decide from that if any of this applies to them.
Beautiful. Thank you so much for taking the time to be with us.
A pleasure. Thank you for having me.
And for all of you who are out there, create an amazing life for yourself and everyone around you. And until next week.
Awareness, integration theory, certification programs. If you're a psychotherapist, clinician, or coach ready to elevate your impact, I invite you to become certified in the Awareness Integration Theory, AIT model. AIT is a structured, evidence-informed approach that strengthens emotional regulation, reduces anxiety and depression patterns, and helps clients create lasting change. Our training is practical, clear, and immediately usable in sessions, so you can work with more confidence and consistency. Join a global community of practitioners shaping the future of integrative mental health. Become AIT certified today. Visit awarenessintegration.com.